So for those of you who met me this morning, my name is Andrea, and I'm a nurse practitioner. Does anybody know what that is? Anybody? A nurse practitioner? No? You don't? Do you have those in your country? So a nurse practitioner is someone that's done specialty training. So I'm a nurse with extra education. So I'm not a doctor. I don't want to be a doctor, but I boss them around. They listen to me sometimes. So I'm going to tell you a little about Oregon reproductive medicine, and this is really hard to talk here, huh? How about I move around? So I have my slideshow, but you can't see it, so I'm going to talk about it. So I think it's really important for you to understand the things you're trying to learn today, which is a lot of information to put into your brain. So what you're going to do is take all this information, go home, and kind of try to figure out what it is you're supposed to do. And my job is to kind of tell you what we do and see if it matches what you're looking for. So the first thing I would tell you is, and I've heard some of the speakers today, is to be optimistic, because you have a very good chance of being parents. And that's exciting. A lot of the patients we see don't have the same potential for pregnancy that you do. So you have the egg donor, right? You have a surrogate, and you have you. And hopefully all of those are well and healthy, and the chance of pregnancy with that in our program is very, very good. So I think being optimistic is where you start from. The fact that it costs you an arm and a leg, right? You get that one? Arm and a leg, a lot of money. Yeah, costs you a lot in time, energy, and struggle, right? Because what should you do? How do you pick? How do you know what you should be doing and with whom? At Oregon Reproductive Medicine, we have 5 physicians. We have 93 staff. A third of our staff is devoted to our international patients. We don't do as many cycles as some clinics do, but we put a lot of energy into being able to care for you. And we feel that in order to do that, we need a number of people that are able to help you in that process. So we're dedicated to that. Optimistic. Okay. Not all clinics are the same. And I think I mentioned this morning, for those of you who are, anybody in business, in banking, any bankers, any engineers? Engineers? Oh, I knew it. Okay. For those people, it's all about looking at statistics, and that's really helpful to kind of drill down to what's really important for you. So we have an organization called SART. It's S-A-R-T. You go SART.org, and you can look at different clinics and what their pregnancy rates are. And it's a voluntary organization that we subscribe to, so you don't have to do it. So some clinics that are really bad don't even go on SART. So if they're not even on SART, that's not a good sign. If they are on SART, they publish their data. And so you need to look at a number of things. You don't want to just look at, so they have pregnancies under 37, 37 to 39 and older. What you want to look at are a number of things. You want to look at the pregnancy rates under 35, because that's young woman like you're going to be having with your donor, right? You want to look at the frozen egg embryo transfer rate. You want to look at there's donor egg, but donor egg is listed as all donor eggs. And so they were saying this morning, some of the women using donor eggs are poor prognosis patients. Their uterus doesn't look great. There's a whole lot of reasons why they are not as good a prognosis patient as your surrogate is. So when we calculate it, we look a little bit differently at those numbers, and I think that's what Dr. Doyle, the guy before, was talking about. Our pregnancy rate, this is our latest that we have in just one treatment. The pregnant live birth rate, if you transfer one embryo, is 80%. If you transfer 2 embryos, it's 91%. So basically what we're saying is the chance of you in this program taking home a baby are very good on your first attempt. Does it always happen? No, because even if it's 91%, that means 9% are not going to be pregnant. When I first started doing IVF, the best pregnancy rates we had were 12% with the best prognosis patients. So between the time I started and now, we're talking about numbers that we could never imagine. So those are the good things I can tell you. That's where you're going to be optimistic, right? Unfortunately, in our program, if you or fortunately, depending on what you want, if you transfer 2 embryos in our program, the chance of having twins is 75%. They were saying 40% earlier today in a program. And again, all programs are different, and that's what ours have been. If you transfer one embryo, not so much, maybe 2%. So steps in the journey. First thing you have to do, so there's kind of like 3 pieces to this. You get an egg donor, you get a clinic, and you get a surrogacy agency, or surrogate, or whatever you're doing. So basically 3 things. In our center, we have our own egg donors. So they're exclusive for our patients. So nobody, and a lot of the agencies, the donor agencies, you can look on webs and you'll see thousands of egg donors. It's different. We only have an in-house egg donor agency, and it's only for our patients. So you can go and look on our website. If you've been our patient, if you Skype with us or talked with us, even if you've talked with us here, we'll give you the login and you can look at our donors. We have about 110 to 130 of them. At any one time, you're only going to see maybe 40 donors up on the website. Because in our agency, the only ones that are going on the website are those that are actually ready and screened and ready to go. The difference in our egg donors, and there's a couple things that, why do we have these high success rates? So I'm going to try to tell you why I think, and this is one of them. We're incredibly selective with our egg donors. We pre-screen all of our donors. So instead of waiting until they're matched, which is what a lot of clinics do, maybe they do one little test, they look at their hormone levels or whatever. We do a 26 or 27-page screening on them. We have them meet with our geneticist. We have them come in. We do an ultrasound. We look at their ovaries. We look at their hormone levels. We do a blood test to look for infectious diseases. We have them meet with a psychologist. And we do a very, very intensive genetic testing for carrier diseases. Do you know has anybody talked about that today? Testing for carrier states? Okay. So you all have thousands of genes and you carry different things. Some of them are no big deal because if you only have one copy, so if you're a carrier, say cystic fibrosis, but you're not, that's a good thing, right? But if you're a carrier for cystic fibrosis and you're a carrier for cystic fibrosis, what that means is your child may have a 1 in 4 chance of having the disease. Some of these diseases are terrible, really terrible. Some are not that big a deal. But we test all of our donors for at least 107 of these carrier states, so that when you look at our donors on the website, you're going to see that they're a carrier. It scares you when you first go on. You look at it, and you goes, she's a carrier for alpha trypsin, blah, blah, blah. And you go, okay, that sounds really bad, but it's not. But what we'd want to do is part of what we do for you is we also screen you. So we have a very in-depth sequencing test that we do for you, so we see that you're not a carrier as well. So that's something that we do up front, which I think is, again, one of those reasons that we're successful. So good egg donor. You guys listening to me? Good egg donor, important. Okay, good agency, make sure they know what they're doing. And if they say they have 1,000 egg donors, I'd be really worried. That doesn't make me feel very good. It usually means they're pulling from all different places and giving you all these people that you think are ready to go, but they're not really. And so I would be aware of that. Okay, so in our clinic, you can see pictures of the egg donors. A lot of people have asked about known and anonymous donors, and I think one of the who's French here? French? You're French? Yeah, only one? Come on, fess up. Okay, you're kind of French. You're kind of all over the place. I've noticed that a lot of the French want to be known to their egg donor. They want to know them, or at least have met them, or Skyped with them, or something. So a lot of our egg donors are fine with that. You'll see on their profile if they're comfortable being known or not, they'll say. So they can be known, they can be anonymous, which is pretty funny in this day and age because Facebook, everybody knows everybody. And there's also something called a donor sibling registry. And what that is where the donor can email into this company, and you can also email into the company and they can connect you, but you don't share information. So that's a third way. So you'll see the donors have different ideas of what they want to do. Remember, these ladies are what, 20 to 25 years old. They don't really understand what that means 20 years down the road when your little boy wants to talk to his genetic mother. That's kind of crazy, but they do think about it, and we ask them to think about it. They meet with our psychologists and talk about it as well, so we do the best we can. But I think most of them, the ones that have met, I'll be honest, the ones that have met their intended parents would say they'd never do it any other way. It's just been so wonderful for them to get a chance to meet you guys and be a part of that. Quiet down, isn't it? So how does this work? So you pick an egg donor from our agency. You usually Skype with the physician. Usually Dr. Bankowski would be here, but the kid with the broken leg, and he's not here. So he's happy to Skype with you and talk with you if you want to hear more about the program than I can tell you today. But you would have a visit with a physician. They would talk about what you need to do. There's some testing that you can do in your country. So some blood tests and an exam and that kind of stuff that we'll walk you through. Don't worry about it. Just kind of think about it. And then at some point we need sperm. We got eggs. What do we need? Sperm. So we have you fly to Oregon. There's actually a direct flight from Amsterdam if you're interested. Kind of a nice flight. Have you fly to beautiful Portland, what I told you about Oregon, right? And it's beautiful, and you'll have a wonderful day or two there. We call it the Portland Visit. Great restaurants. There's no tax, so tax-free shopping. Everybody gets an iPhone. I swear to God, everybody that comes to Oregon buys an iPhone because there's no tax. I don't know. Are they expensive here? Are they? Okay. So when you come to Oregon, you can get your iPhone and shop. And there's some great shopping. There's great food. It's a very eclectic community. So people really, I love it there. So it's fun. So you'll come there, and at that time, we'll freeze your sperm. We'll do blood testing, which is very specific. The FDA is in our business, and they have a questionnaire, and they have blood tests and all that. You probably heard all this stuff. And then we'll freeze your sperm. It has to be done within 7 days of freezing the sperm. So we'll test it, we'll freeze your sperm, and then now we've got sperm. We've got eggs, we've got sperm. What's next? Come on. What? Yeah, put it together. You got to get here. You put them together. We fertilize them, and we offer. This is kind of. I don't know if you guys can see this, but this is what a really beautiful egg looks like. Can you kind of see that? That's an egg. It's not fertilized. It's beautiful, though, isn't it pretty? Okay. This. Uh-oh. We're frozen. Uh-oh. Oh. Okay. Okay. This is a beautiful egg. This is, if you look really carefully, there's a needle. Can you see the needle? Can you see the little dot in there? That's the sperm. We only need one, because what we do is we inject this little sperm into the egg, and it fertilizes. Not all of them fertilize, but a good percentage of them do. This is a fertilized egg. There's two fertilized. Well, this is one egg. You're using many eggs. So basically, an egg donor is going to give you 5 eggs. One egg. It can. That's not as. It's better to have. I'm sorry. It's better to have two twins from 2 different eggs than it is to have it split. They do occasionally split, but we don't like that. It's a riskier pregnancy often. So I mean, sometimes it just depends. But so that's a fertilized egg with 2 pronuclei, and it's really. Then we go, ooh. The next day we say you had 20 eggs. Of those, 15 were mature, and of those, 14 have fertilized. Something like that. So that's the call you get. And you know what everybody says? What do they look like? And you go, what do they look like? 2 eyes, something like that. Okay, you want to push down for me? Since she wants me to talk, thanks. This is a day 3 embryo. Isn't that beautiful? That's a flower. We call that the flower. Somebody was talking this morning about biopsying, and they were saying about biopsying 1 cell. They were biopsying on day 3, and they were taking off 1/8 of probably this embryo. So we don't do that in our lab, and I'll tell you why in a minute. This is, okay, now here's the coup de grace. Isn't that beautiful? A little oohing and eyeing would be good here. Nice. This is a blastocyst, and you probably heard that word today. And the inner cell mass, that's the baby. This is what's going to become the placenta of the baby. So when we do biopsies and when we're looking at chromosomes, so there's 2 different genetic testing. The one testing I talked about, which is looking at carrier states. The second test that we're talking about is actually biopsying this embryo to see if it's chromosomally normal. And what does that mean? You have 23 chromosomes, right, from each of you? And that's what it should have, a set of 23 chromosomes. Anything other than that is abnormal. So a 21XXX is Down syndrome. 23X with an O is an abnormal girl. So do we want to transfer those embryos? No. Do we biopsy a lot of our patients? Yes. Somebody this morning was saying they don't do it because they don't think it's necessary in a young egg donor. what we found, and we're one of the best clinics in the country at doing this because we do it all the time and we're really good at it. We have the lowest abnormality rate of anybody in a study that's going to be coming out pretty soon. And we have 24%, 25% of these embryos from these lovely young women are abnormal. It's because that's human nature. What would normally happen with these embryos? If we implanted them, they would usually cause a miscarriage, they wouldn't go on, or they would have a baby that had a disease. So I would say the majority of our patients are biopsying these embryos to see that they're normal. So we can do that. And so we biopsy them, and then we freeze them, and we save them for the surrogate. And now I can talk some more. Okay. There's PGS. You guys have heard the words PGS, PGD. Okay, we have a new word. I'm sorry. It's called CCS, Comprehensive Chromosomal Screening. It's the same thing. Basically, we're taking a piece of the trophectoderm of the outside of this embryo, just a small piece of 5 to 7 cells, and we are, what we're going to do is we're going to, oh, we change again? Oh my God, I gotta talk fast. Okay, I didn't know it was so fast. Anyway, what we do is take a little biopsy, we evaluate it. We're the few in the country that has in-house sequencing, so we do it ourselves. We don't send it anywhere else. We do next generation sequencing, which is even better than CGH, which is a lot of big words. But what I'm trying to tell you is these guys where I work they're amazing. They are amazing. And you know what? I'm really old. I don't have to do this for a living. I'm here because I believe in this clinic and what we do. So that's the truth. Okay. Northwest Surrogacy we work a lot with. It's our partner in Oregon. We're not related to them. We aren't attached to them monetarily, but it's a really good surrogacy clinic. So one of those things, again, if you want the best success, you look for the best egg donor, you look for the best surrogacy agency, and that's what you want to walk away with a baby on the first attempt. Our goal is to get you a baby as soon as we can. That's yours too, right? Okay, so why do you come to us? You come to us for the reason I said. High pregnancy rates, in-house donors, we have highly skilled in embryo biopsy. And we're really nice people, in case you hadn't noticed. Oregon folks are really nice. See? Okay. And we have very little pollution. We have green, yeah. Okay, we have green stuff. Okay.